I'm Ming-ming. I'm the 4th year Advanced Endoscopy Fellow at Weill Cornell this year. Well, it's been a fantastic year overall. I think there's many highlights and from this year, but I think what I like the most is just looking back now at the end of this year from where I started in July 1st. It's just the incredible breadth of patients and problems and skill that I've gained through this year. I came here to learn advanced therapeutics, and I've gained so much more than that. I've now learned resectional therapy with endoscopic submucosal dissection, endoscopic sleeve gastroplasty. I've learned POEM for treatment of achalasia. So the breadth of patients that we've taken care of here and the breadth of my skill at the end of this year has just been incredible. And obviously our team here is fantastic, and working with the team has been a favorite part of my year. I think this is a tough year in the sense that with advanced endoscopy and the type of procedures that we do, there often are more complications that we experience this year than with general GI practice. Something I've learned this year is that although complications are inevitable and they happen, it's not the complication that really defines you. It's how you deal with the complication and come back, fix the complication and move on and learn from this mistake and make sure it never happens to another patient. Learning how to process the complication and also to deal with it from a medical perspective, that's really important. But obviously having more complications is something that's tough, and for any physician who's training, I think that's a tough thing to deal with. Definitely one of the highlights from this year is when I did a POEM procedure, a peroral endoscopic myotomy procedure on my own. Dr. Kahaleh was in the room, and I know it was hard for him. He didn't touch a scope, and he let me do the entire procedure. I think that was a really important, very remarkable case, because I had been learning bits and pieces of the procedure all year, and this was kind of the culmination of all of those pieces coming together in one case and one patient. The patient did very well, and the case went very well, so that was definitely a highlight. Well, obviously the basics, the team, everybody here always tells me just go back to basics. The basics here are EUS and ERCP. On top of that, we do a lot of therapeutic EUS procedures, from EUS-guided biliary and pancreatic access to EUS-guided drainage of various fluid collections. Obviously, we're a center for resectional therapy, and we do endoscopic submucosal dissection and resection of various lesions in the GI tract. And we also do a lot of POEM, which is treatment for achalasia. So all of those procedures I've learned this year. We are also a referral center for treatment, endoscopic treatment of obesity, and we do a lot of endobariatric work. So the breadth of the experience I've had here is truly remarkable and truly incredible and quite unique, I think, in the country. I think in the beginning, obviously learning how to cannulate, getting into the bowel duct, being able to do an ERCP was very exciting. And I would say in the first 3-4 months of my training, that was absolutely my favorite procedure is ERCP. And then as I've progressed through the year and I've gotten exposure to the other therapeutic procedures we do here, I've really grown to love POEM and ESD, resectional therapy. I think those stand out in my mind currently. In 20 years, I hope to still be very active as far as doing resectional therapy and doing all of the therapeutic procedures that I've learned here. But I think advanced endoscopy is certainly going to progress. I hope it will progress in 20 years. It won't stay static, and I think we're going to have a whole new set of tools to help us with resectional therapy and the type of lesions that we're able to resect. So I hope that I'll be a part of that, and whatever new skills and new tools and come to help us with that, I'll get a chance to use and learn, and I'll continue on this path.
Would you do it again if you had to do it?